Well, good morning, everyone. I'm glad to see people are talking and having great conversations. Thank you for coming together for our October campus update. Relatively short discussion today, but there are some things that I wanted to make sure we shared with you. And as we always do, I want to start by recognizing the incredibly talented faculty we have here who are continuing to contribute to the research enterprise. Since our last meeting in September, the university has received over $1 million additional dollars to support the work that we do. I do want to call out Dr. Kazimov, who is responsible for about $440,000 of this from the National Institutes of Health for the Institute on Aging. So congratulations to all of you for this great recognition for your work. But it's amazing. I expect to see more coming in. Dr. Rebecca German, I think all of you know, is our Vice President for Research. She has shared that the national impact that's been taking place at the NIH has really not affected the university. That is not what we're hearing from the other universities in the state. And I think that too is just a reflection of the quality of people that we have at this institution. We have 3 brand new appointees through the governor's office to our board of trustees. They will officially attend their first board meeting in December. We are currently down 3, so it was great that the governor brought in the 3. We've been behind for a little while. Some of you may know Ed Roth. Ed used to be the president and CEO of Altman Hospital, and he just finished serving as the chairman for the National Football Hall of Fame. Heidi Gartland is with the Government Relations Office at University Hospitals, and she currently sits as the chair of the Cleveland Fed. And then we have Kathy Dosick. And Kathy Dosick is coming to us from the New Bremen area, where she works for Crown Equipment, and she also sits on the New Bremen Foundation. She has been one of the key figures who's been responsible for a lot of the artwork coming in from the Dickey Foundation to the university over the last few months. We have much more to come. I understand there are some statues that are going to be putting up pretty soon, but we're excited to have 3 new trustees. We now have a fully appointed board through which to oversee the university. We mentioned this once before, but we're really very pleased to have had Dr. Richard Wardrop come join us. He starts officially November 1st, so Monday of next week. He is dual boarded in internal medicine and in pediatrics. He is an MD PhD who graduated from Ohio State University. That's the second best medical school in the state of Ohio, this, of course, being the best. But we're excited to have him join us. He's also the chairman of the American Board of Internal Medicine. So he brings a lot of talent and expertise. If you're interested in seeing him as a patient, he will be operating out of NEOMED Healthcare. And we are reintroducing the Strategic Initiative Fund, or the SIF, as people like to call it. It is now opening up. We created this when we first launched our strategic plan back in 2020, and it's a way to provide dollars for you to organically contribute to the university's mission, vision through the strategic plan. And it's been very popular. We've spent millions of dollars now through this program and seen incredible things start up because of it. But this was now made available. If you want to use the QR code, you can, or you can go to our website. And this is a time to start putting together applications to fund some work that you and your colleagues may think are going to be beneficial for helping the university achieve the mission that we are set out to do. We'll get a bigger update on the new strategic plan from Lacey Madison, first briefly next month as she talks about how you can get involved. And then again, when we return in January, she's going to give a presentation of all of the different elements of the strategic plan, the goals, the objectives, and the way we are going to be tracking those. Our student research symposium that we hold every year, it's incredible. It continues to grow every year, in fact. That's partially because of the great students we have here, but it's also in part due to the advocacy of Dr. German, who has been pushing for more and more support for our student research activities. And as I mentioned in our last update, we've now doubled the amount of dollars that we're making available for the Student Research Summer Fellowship Program. I hope you're able to join us to listen to the students, to see their presentations. Perhaps some of you can be involved in the judging that takes place, but that will be coming up in just a few weeks on November 21st, just about 5 days before we break for the Thanksgiving holiday. Our Vitals program continues to be really an exemplar program in leadership in healthcare. This month, coming up in November, we'll hear from Dr. James Stoller, or Jamie as he is often called. Dr. Stoller is the Chief of Education for the Cleveland Clinic. He has had significant impact at this university, and he has been involved in many of the university's educational activities over the course of his career, and we're really pleased to hear from him on November 6th. This will be a virtual event, so I hope you take the time to log in and to watch this from your computer at your workstation or from your personal computers. Should be a great presentation. The Ideator is a program that university hospitals and NEOMED created together. The idea was that we would put together teams of people from interdisciplinary backgrounds, physicians, nurses, pharmacists, people from the community, medical students, pharmacy students, graduate students, put them in a room and feed them one of the biggest problems that we have in healthcare, and give them a 2-day period through which to go through a brainstorming session to craft an idea that could solve that problem, to present it to a large group of judges, and then we would provide funding for the top awardees to move their ideas forward. We've had some really great ideas come out of this university. Some of those have been around childhood trauma. Others have been attacking things like infant mortality. This year, we're going to be focused on environmental impact. And Cleveland is no stranger to environmental conditions and issues. Certainly, lead abatement is going on right now, but many of the healthcare problems that we have, the biggest ones that impact our communities, are all associated with the environment to which we're exposed, and many of those exposures are still being understood today. Our campus safety initiative, the term being used for this one this year is Run, Hide, and Fight. There are multiple opportunities to gain training. We ask you all to do this. I think every one of us turns on the news in a given week and sees something really bad that's happened, oftentimes at a university or a high school. It's not a safe world that we live in. We want all of you trained to know what to do should an event occur on this campus. Our police force is ready to go. The executive team has been briefed on how to manage it, but each and every one of you individually are key to ensuring your own safety and the safety of your colleagues. So we ask that you take this seriously. Please find a time to do the training so that you're prepared and you know what to do on this campus if we're unfortunate enough to have one of these events occur here. The big question we've been getting is, what about open enrollment? What are we going to do with our healthcare? I've been telling this group month over month that our healthcare expenditures have been exceeding the amount we're paying in premiums. So that means currently AltCare, they charge us money to be able to insure you every month. There's a premium paid. But the amount of money they're spending has exceeded the amount of money we're giving them. And there's actually a federal law that dictates what that ratio is allowed to be. So when we met with them about renewal of our health benefits, AltCare told us that it was going to be about a 30% increase to your premiums. You may remember that we switched from SummaCare to AltCare because the same issue was happening, and SummaCare was going to raise our premiums by about 60%, is what they told us initially. We heard from AltCare it'd be about 30%. That's a big number. So we took a look at where we are. Couple of things you should know, and we'll make sure that we get this out to you in graphical representation. The organizations that track health insurance, especially at university, compares us to about 500 other university-level bodies to say, where do you sit relative to your benefits? We're really in pretty good shape. If you look at our PPO plan, that's the That's the lowest deductible plan that we offer. Our current plan sits in the top 15th percentile in the nation. So we're 85 or above compared to the 100% you would look at in total, which says that we offer a really, really strong plan. And in fact, the individual deductible on that plan is $800 a year. Mary tells me that this data point says it's $1,500 typically at most institutions. So that means we pay a little bit more because we do have this top plan. But then we look at premiums paid per person for that plan, and the university is in the top 20th percentile in the nation, meaning 80% of those outside of this institution actually pay more, and they're paying more for a lower quality plan based on these numbers. So our job was to try and figure out how to maintain these benefits for you as best as we can without trying to pass on a 30% increase. So Oswald and Company has been working with us. We went through multiple brokers who these came back as quotes to us, and ultimately Medical Mutual came back with the best opportunity for us. Now, those of you who've been around for a while know that we used to have Medical Mutual here at this university, and they were very pleased, we're told, with the access that they received. It's a very, very strong network in Ohio. So we've opted to move back to Medical Mutual. That'll take place over the course of the next month as you go through your benefits. The Cigna network that we currently have is the same network we're still going to have outside of Ohio, but we'll have the Medical Mutual network within Ohio, which again, they're telling us is the most robust network that we have. So for instance, Mary's told me that if you go to Southwoods, which is a concierge level care program out in the Youngstown area, they aren't taking the AltCare Cigna platform that we have, but they do take the Medical Mutual platform, as do almost all other providers in the state. So this should be a very good program for us. Now, it says here under 9%. We have the gold plan, that PPO plan. That one will go up on average about 8.5%. If you're in one of the other higher deductible plans, we have one where the deductible is $3,500 and one where it's $5,000. Very few are in that plan. The $5,000 plan, based on the way it was quoted to us, will go up about 3.5%. But if you're in the $3,400 deductible plan, there will be no change. You're going to have the exact same rates that you have today. So we were able to negotiate something I think is going to be very beneficial for the university. And we're constantly staving off these attacks because obviously healthcare costs go up about 9% per year on average. So I want to really thank the HR team for working with Oswald. They were able to get us from 30% increase raise down to, well, none for some of you, but as high as about 8.5% for others. The university, of course, is going to split the percentage based on the salary tier that you're in. So we're all going to be taking that increase together. There will be no change to dental, life insurance, or disability. Our dental plan was a 2-year plan, and so we are with it for another year. In the meantime, over the course of this year, we will look at opportunities for all of our plans to make sure that each year we're getting the very best opportunity together. Medical Mutual did state that they would honor the ability, which we're required to get separately for each institution that we work with, that they will honor the no copay should you choose to go see a provider up in NEOMED Healthcare. Open Benefits Fair will be tomorrow, October 28th, just to give you some more information on these plans, but the HR team will be working during open enrollment period to help you better understand which is the right choice for you based on who you are and what your healthcare utilization is. Cybersecurity, we do have cybersecurity training come up very soon here. It's an important element for all of us. Again, you've heard about things like bad mass shooter events occurring on campuses, healthcare going up. The other one is cybersecurity. It is a big deal. Universities are being held hostage by cybersecurity attacks, threatening to release FERPA information or confidential information on employees. And so our team works really hard in the IT department to prevent these type of attacks. And we get them all the time. I especially get quite a few of them. I think I specifically get targeted because of my position. Fortunately, I've not fallen victim, and I often identify an email and will send it forward to the IT team to do something about. But one of the things that we have to do is we have to test our defenses. And so the IT team has done that. And you may or may not know that they do that. This is common practice. They will send out emails themselves to see whether or not you fall victim to phishing scams. And one of those was done last week. And about 11% of our population clicked on the link, which you don't want to do. Now, if you only clicked on the link and you stopped there, you probably wouldn't have caused a problem. I don't know, our IT department may say you could have anyway if it downloaded something. But we did have a very small percentage who actually went into the link and then gave them all the information about themselves. So this was a test, and so we know that education is going to be important for us. There have been quite a few attacks on us over the course of the last few years. Some of those have resulted in external entities getting dollars from the university. We've managed to get most of those back, but these are all because we answer emails that are really not NEOMED emails, and they trick you into doing something that you would not intend to do. So please do the training, work with the team. Cybersecurity is pretty critical for all of us, especially today. The Human Resources Department is continuing to offer workshops to help you improve and better yourself as a professional. Some of these include the Mastering Crucial Conversations discussion and Management Fundamentals for Leaders. But they have also made available to all of you now LinkedIn Learning, which is a really powerful platform. We decided to go with this instead of Academic Impressions that we've had in the past because it's a much more robust set of offerings. We've had over 100 people already sign up for this within the university, and the links were put out to you last week. I went on this weekend. I already completed 3 certifications just to go through and understand what the courses were. I think some of them are really good, some of them are okay, but there's certainly ways for you to benefit and develop yourself, and it's at no cost to you. On November 10th, we'll have a special event on this campus, and I want to thank Dr. Faison, our provost, the marketing team, and all of those who've helped him to develop this program. We have 14 Service Academy, Service Academy cadets and midshipmen. That's what the Navy calls their students. So the midshipmen and the West Point cadets, Annapolis and West Point. No, the Air Force did not come through yet, Dr. Faison, but they will be here on our campus. They have an opportunity to learn about a program. Some of them are going to get a special interview for medical school while they're here, and we'll do a military celebration recognition. We're expecting our guest speaker that day to be Bill Johnson, who is the former congressman, U.S. congressman for the state of Ohio and the current president of Youngstown State. So I encourage you to attend if you are able to celebrate and recognize these individuals coming in. It's really bringing some talent that we normally weren't getting before to this university. And related to that, we have a day off the following day on Tuesday at this university. It's Veterans Day. It's a time to celebrate the patriots, many of whom have given a lot for this country, all of whom have served to put potentially their lives on the line for us, and it's a chance for us to be able to honor them. So please think of veteran when you have a moment for everything that we have in our lives, but take that time and think about it as you're celebrating with our holiday on November 11th. Now, if I could, I'd like to ask Officer Trent Alberts to come down. I see you in the back, Trent. And as he's walking down to the front, I want to recognize Trent for doing something really outstanding. The Portage County Sheriff's Department called the university police to ask for assistance. And when they did, the assistance they had was extraordinarily important, and it was really a time element to do this very, very quickly before something bad happened. They called and said to our police officers that we have a missing child. I believe it was a 5-year-old girl with special needs. They were really worried about what could happen to this young lady. And Officer Alberts responded immediately, and within a matter of minutes was able to locate this young lady and get her safely back into the arms of her parents before something catastrophic could have happened. Anything from kidnapping to being injured by a car to potentially being killed because of traffic nearby. So I want to thank you very much. I'm going to give you something. And while it's certainly a small token, I wanted to give you a couple of items from the university. One, this is the very first one we're giving out at this university. This is a jacket that is promoting the NEOMED Miami University and Christ Hospital partnership that we've just cemented together. And given the way they played this week, I'm going to have to call this the second tier prize, but it's the, it's the Browns NEOMED shirt for you to be able to have. Thank you very much, really, for all that you do. For those of you who don't know, Officer Albert says a beautiful young daughter of his own. And the story he told me was when he got the call, he thought about her and how important it was for him to be able to respond right away. Thank you very much. Okay, some of the funner things that we do, HR and Provost Office Student Services really go out of their way to try and make this an engaging campus, to make sure we're taking care of our students, our faculty, our staff, that everything isn't work, that there's fun built into everything that we do. So Fall Fest is taking place. It's already started. But the big one on Fall Fest that gets paid attention to is the annual trick or treat, when this university seems to really go out of its way to try and outdo each other through their decorating for a Halloween contest. I believe the provost office won the last 2 years. Is that right? Yeah. And prior to that, it was the president's office who then got beat badly by the provost office. So we're hoping somebody else steps up to really kill it this year. But please engage, have fun, come around, vote. If you can't vote for yourself, that is one of the rules that they have out there. But it is a lot of fun, and I know the group up in my office is, as always, working hard to get something really creative put together, and I get no credit for it. That's this team over here. That's part of the student trick-or-treating. We're also unbelievably approaching the holidays really rapidly. All of the major religious holidays and some non-religious holidays that are coming up in December are anywhere from 6 to 8 weeks away. So the giving tree is done as a tradition every year. Look forward. It's typically outside of Watana Kunicorn, where you can ID a young person, typically somebody in the age ranges of 3 to 14, 15, and you can take their name off the tree and you can buy a present for somebody who's on hard times or underserved. And then HR has also arranged for the Cleveland Cavaliers night. It's NEOMED's night, and that will be on November 23rd. And so with that, relatively short today, after you've heard some long presentations in the past, I'd love to take an opportunity to answer any questions if there are any out there from the audience. Seeing none, I will give you one last piece. Thank you to the large number of you who responded to the survey that Human Resources sent out. It's got the NPS score is the Net Promoter Score. This is the eNPS score, because normally a Net Promoter Score is for customers. This is for employees of an organization, and it is a really high bar. It says to be considered positive, you got to get a 9 or a 10. That an 8, a 7, those are just considered mediocre, and a 6 and below is considered negative. So it's a really high bar to meet. They've been going through and shuffling the information, segregating it, trying to understand the information given to us. And as soon as they finish that, they're going to brief the deans of the colleges, and then we're going to get that information out to you so that you can see the whole score. What came with that were things that some of you would like for us to do a little bit differently. I can tell you that the things that were called out, some of those we can do, some of those we can't do. Somebody did recommend that all 5 days a week be work from home. That's really not possible at the university, and especially at a time when the state of Ohio says they've eliminated work from home, but right now we've been given a carve-out. If we get aggressive with something like that, I think that carve-out would go away. The other question we got was about communication. We've been working really hard on communication at this institution. There's these monthly port outs. There's the meeting with the provost. There's the meeting with a senior vice president. We meet with the students. We try and meet with the faculty separately. We have a executive management team meeting every Monday for 2 hours. That may be going to 3, as I understand it. And we have a representative from the students there. We offer a representative from the university council there as a way to get unfiltered information and then to disseminate it back to you. And it's totally unfiltered, but I think we need to do a better job with the team in that meeting of getting that information back to you once we've discussed it, and then just sharing your thoughts with us internally, because if we don't know that there are challenges, we can't act on them, and this is critically important for us to be able to do so. So communication will be another thing we continue to work on. There were a number of other things. We'll let you know what those were. There were also some great accolades about things that have been changing at the university. I want to thank all of you who commented on those. I don't want it to be a burden, but best practices are to send out follow-up surveys, shortened, so they're quick and easy for you, about once a quarter, so we can see whether we're making progress. Otherwise, we get the information, we look at it, and if we don't hit you up about it again for a year, then the question is, well, why didn't you do anything about it last year? Why are we filling this out again? So please bear with the surveys. We're trying to make them easy. If you do this every week or every month, it does become a bit of a challenge, but there will be some follow-up surveys coming your way. And I don't have readers on, so I've got to get really close to the TV to see. Oh, I guess there's nothing there. There's some writing, but it's not a question. So with that, thank you for your time. Enjoy the cookies and the coffee, chat with each other, and thank you for your time.